Good morning, ladies and gentlemen. Thank you so much for being here. And today, I would like to talk about my research. The formalin RT-QuIC assays detect prion-seeding activity in formalin-fixed brain samples from sporadic Creutzfeldt-Jakob disease patients. In the first slide, I would like to talk about the content. The first is the background. The second is the purpose of the research. Third is the materials and methods. Fourth, the results. Fifth is the discussion. And finally is the conclusion. Prion disease, also known as the transmissible spongiform encephalopathies or TSCs, are a group of rare infantile brain disease that affect a human and variety of animals like a bovine, owl, deer. And the prion disease caused by misfolded forms, the prion proteins, called prions, derived from the proteinaceous infected particular by Brusiner in 1982. And he have a Nobel Prize in the 1997. It's a difference between the PIPC and PIPSC proteins. If the PIPC is a non-infectious and monomer, soluble and protein sensitive, and the structure is predominantly alpha helical, but the PIPC is the infectious, aggregates, and is soluble in the detergents resident to proteinase, readily form and aggregates and deposits and large aggregates in disease tissue, and the structure is rich in the beta sheet. In the next slide, I would like to talk about the classification in human prion disease. We have three subtypes. It's the sporadic type, and genetic type, and acquired type. In the human prion etiology, in the sporadic type, in the sporadic Creutzfeldt-Jakob disease, nearly 76% and 8% from the genetic and only 6% from the acquired. In the next slide, I would like to talk about the human prion protein genes. The human prion protein gene is located on the short arm of the chromosome 20 between the end of this arm and the position 12. And this is the picture so about the diagram of structural variation of human PIPSC related to the PK cleavage patient. In the N terminal to show the wave line, and the variable region shows the broken line, and the C terminal is a zigzag line. This picture shows the correlation between the PIP genotype and determined by MV polymorphism at the column 1 to 9, and we saw about the PIPSC type 1 and type 2. In the slide, in the picture, so the type 1 is from the 95% from the MM1, and the type 2 86% from the MV and VV. In the cleavage side at the type 1 in the A2, in the column A2, but the type 2 is the column 97. This is immunoblotting in the PIPC SC type 1 and type 2. We will go to the slide about the clinical features and neuropathological finding in exceptive in sporadic Creutzfeldt-Jakob disease. In the Europe and Japan, in the MM1 is the most common, only about the 70% or 80 or 90%, and some cases in other is very rare. In the early onset, nearly about 50 to 60 years old, and the duration in the MM1 and MV1 very short, only is the 4 months, but some cases are very longer, like MM2C and MM2T. In the clinical symptoms, usually the most common is the progressive dementia, and some symptoms like visual symptoms, language diffusion, ataxia, and myoclonus. And the neuropathological findings, so the typical and usually is the vascular widespread in the brain. In the next slide, I would like to talk about the diagnosis of the sporadic Creutzfeldt-Jakob disease. If we define if the progressive neuropsychiatric syndrome and the neuropathological or immunocytochemical or biochemical confirmation is the probable if we have one symptom and two of group 2 symptom, and the typical of the EEG, typical of EEG, or the typical of the MRI, or progressive neuropsychiatric syndrome, and the positive RT-QuIC in the CSF or other tissue. And the possible if we have one symptom and two symptoms of the group 2, and the duration less than 2 years. In the next slide, I will show about the progressive in the development of the diagnostic technique for the Creutzfeldt-Jakob disease. In the 2010, we developed about the RT-QuIC assay can detect limit amount of protein, prion protein, with the high sensitive and specific. And it's not about the brain. It can to detect pre-PSD in the CSF and the neuron processing of factory musculature and degassion, and now is a skin pulse biopsy. In the next slide, I will show about the RT-QuIC assay with quantitation of AD50 using an RT-QuIC assay. We have the sample with dilution of the sample, like from the 10 to the power of 5 and to the power of 10. And the substrate with the input in the well with the sample and the substrate and the recombinant protein, and using stacking with the RT-QuIC methods. And this is the picture next. We saw about the percentage of positive reaction decrease the sigmoidal curve within the dilution range when the BS was used as a seed, and the AD50 was calculated using the Creutzfeldt-Jakob methods. In the next slide, I would like to talk about the purpose of the research. Neuropathological in SCCD brain are usually investigated using formalin and formic acid. However, brain tissue in this way are not amenable by biochemical analysis. Previous have been reported that treatment with the acid formic and formalin of the mice and squirrel monkey might have a reduction in effectivity, not biochemical analysis. And there is no evidence to prove on the formalin-fixed brain tissue human prion disease. So we will try to analyze for the formalin and formic acid RT-QuIC to quantitate the seeding activity of the SCCD brain. So we will go to the method. We have a 10K of MM1 native brain and 90K of the 14K MM1, 3K MM2T, and 2K MM2C with SCCD were treated with the formalin for a month and further exposed to 99 formic acid for 1 hour. And 5 non-CCD brain specimens were used as a negative control. So I would like to show about the RT-QuIC machine and RT-QuIC assay. We have an RT-QuIC buffer include about the salt, pipette, ETA, and theoflavin. And it's important is the recombinant prion protein, and the temperature is 45 degrees. And program is seeking and incubation. And the assay were repeated a little time, and the Spalmer-Kappa method used estimate about the seeding activities, seeding dose. We will define a positive reaction by RT-QuIC assay. The absorbent rebound within 100 cycles, and after reaching the maximum absorbent, the level is the absorbent is stable. The maximum absorbent is more than 6 times higher than the starting absorbent, and only recombinant protein will use and maintain the quality of the loss the prepared confinement protein. So the AD50 more than 10 to the power of 7 by RT-QuIC assay. We established AD50 in SCCD patient using an RT-QuIC assay. We found that it's a native brain, with the treatment with the formalin and with combined formalin and formic acid. It's a negative control. So the prion-seeding value of the SCCD brain decreased 2.5 log after formalin fixed, we got further reduced by around 5.63 log AD50 following the combined formalin and formic acid. And the endpoint RT-QuIC assay was performed 2 times. The next slide, I would like to show about the summary of the sporadic Creutzfeldt-Jakob disease patient. We have a 19 case of, this is the case based on the patchy classification. And this is the results of the log AD50 in the native brain. And this is the formalin-fixed brain and the combined formalin and formic acids. And the prion-seeding values of the SCCD brain decreased 2.36 log AD50 after treating with the formalin. It decreased about 10 to the 7.6. We got further reduced around 2.8 log AD50 after combined formalin and formic acid in MM1. In the next slide, we will summarize the seeding activity reduction by formalin and formic acid treatment in SCCD patient. And the average of log AD50 per gram tissue reduced after treating with the formalin and formic acid in MM1 was 2.89, MM2T was 2.02, and the MM2C was 2.69 respectively. So I will go to the discussion to learn this of the brain tissue which were treated formalin and formic acid by endpoint RT-QuIC assay to conduct neuropathological analysis in patients with human prion disease. The brain tissue is routinely fixed with the formalin and treated with the formalin and formic acid to reduce the infectivity of the abnormal prion protein. So performing biochemical analysis on formalin brain is difficult because proteins are rapidly denatured when the brain immerses in the formalin solution. In this study, we successfully measured prion protein activity in the formalin-fixed brain sample and formic acid treatment. So subsequent more than 99% formic acid treatment after formalin fixation decreased the value of the log AD50 in the MM1, MM2T, and MM2C case approximately 2.8, 2.69, and 2.04 respectively. Therefore, the seeding activity of MM1K combined formic acid and formalin was decreased by 100 and 1,000 compared with the MM1 native brain. So our research is the first to report how infectivity changed the treated brain tissue of SCCD patient. So Takaski et al. So that the AD50 titer from the 7.7.5 is the limiting point of transmission for the human clone in mice. So from our research, we found that the formalin-fixed brain of the MM1, MM2C was infectious, but MM2T was no infectious. And all samples after combining with the formalin and formic acid treatment was no infectious. And formalin acid treatment is a useful method to reduce the risk of exposure of laboratory workers to high infectious of preprod. So I would like to show the conclusion. We successfully established endpoint RT-QuIC for formalin-fixed and formic acids of the SCCD patient. We were able to detect AD50 in formalin-fixed brain of SCCD patient, and pathological analysis and quantitative biochemical methods can be performed after RT-QuIC. In the future, endpoint RT-QuIC with the formalin-fixed SCCD brain sample will be useful tool in the combination with the neuropathological analysis to improve understanding of the SCCD. So in the 2022, Nakaski et al. Have been used the application, the formalin RT-QuIC assay to detect the 75 cadaver, and they found out 1K of positive in the New England Journal, and they found out the mean AD50 of the special from the frontal lobe was 10 to the power of 6.7. Finally, thank you so much for time and attention. Thank you.